Good morning, Mr. Smith. My name is Sandra, and I'm going to be your nurse today. If I can check your ID band, please. We're going to assess for 2 identifiers. Can you please tell me your date of birth? Awesome. All right, Mr. Smith, I'll be right back. I'm going to do a head to toe on you. Are you in any pain? Okay. So I am going to gather my equipment, make sure my equipment is functioning properly. I am going to wash my hand, don gloves, and provide privacy. All right, my bed is at a comfortable working height. I'm going to go ahead and ask Mr. Smith. Mr. Smith, by the way, can you tell me who the President of the United States is? Awesome. Do you happen to know what time it is? Great. I want to assess Mr. Smith's mentation or his level of consciousness. So I'm going to assess his scalp. Okay, for any infestations would be at the nape of the neck where the heat is. I'm going to assess the scalp for any breaks, any moles, any lesions. All right, I'm going to assess the forehead or the face to make sure the face is symmetrical. I'm going to assess Mr. Smith's eyes. I'm going to assess for perla. Mr. Smith, I'm going to shine light into your eyes. Okay, just for a moment. Okay, the pupils are equal, they're round, and they're reactive to the light. Mr. Smith, if you can look straight ahead, try not to move your head. Very good. All right, one more time. Please follow the pin and not move your eyes only. All right, here. We're assessing for extraocular movement. All right, so there is no extraocular movement. All right, I'm gonna pull down the lower conjunctival area. Okay, there's no redness, there's no irritation, there is no eye discharge. I'm gonna look into the nasal mucosa, there's no discharge. Okay, he's not wearing any oxygen, there's no labored breathing noted. Mr. Smith, I'm gonna assess your oral cavity. All right, Mr. Smith is wearing partials. Okay, his oral mucosa is moist. There's no redness. There's no irritation. Mr. Smith, can you stick out your tongue for me? Very good. All right, I'm going to go ahead and use the tongue depressor and assess for gag reflex, which is cranial nerve number 9. Okay, the glossopharyngeal is cranial nerve number 10. Okay. All right, so the lips are moist. There's no breaks in the skin on the lips. We're going to assess the ears. He's not wearing any hearing aids. There's no drainage coming from the ears. Okay, we're going to assess the neck. Okay, there's no swollen lymph nodes. Mr. Smith, can you turn your head left and right? We're assessing for range of motion in the neck. There is good range of motion. There is no pain. I'm going to do the shoulder shrug test. If you can lift up your shoulders, Mr. Smith, and I'm going to slightly press down on your shoulders. Very good. That is cranial nerve number 11. All right, so now we're going to go ahead and assess your lung sounds. Okay, Mr. Smith doesn't seem to have any issues with breathing. His chest rises and falls evenly. So I am going to assess for lung sounds. Okay, there's 5 placements in the front. There's 1. Breathe in and out. All right, 2, 2, 3, 3, 4, 4, and 5 placements in the front. Okay, Mr. Smith, do you have a cough? Any congestion? There's nothing noted. His lungs are clear. Okay, so now we're going to assess posterior lung sounds. There's 9 placements in the bag. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 7 down here, and then 9 on both sides. Okay, his lung sounds are clear. With auscultation, I am going to assess heart sounds. Okay, I'm going to use the bell of my stethoscope to assess aortic, pulmonic, Erb's point, tricuspid, and the mitral valve, which is mid-clavicular, 5th intercostal space. Okay. Mr. Smith, when was your last BM? He had a bowel movement this morning. Was there any constipation, any pain upon having a BM? There is no pain. All right, so I am going to palpate the abdominal area for any masses, any lesions, any abdominal distension. There is no distension present. I am going to percuss, all right? Okay, there's no pain there. Mr. Smith, how is your urine? Is there any pain during urination? There is no pain during urination. His urine is yellow and clear. He does not have a Foley catheter. He is not incontinent. All right, so Mr. Smith, I'm gonna turn you over and assess your back for any skin breakdown. So we're gonna turn you over. We're gonna assess the back. The skin is clean and dry. The sacral area is intact. He has no complaints. There's no vaginal discharge coming from the patient. There's no complaints regarding the perineal area. I am going to assess the arms, the range of motion. There's good flexing and extension. There is no pain. The wrist with flexion and extension. The skin is warm and dry to touch. There's no breaks. I'm gonna assess the capillary refill. Less than 3 seconds. I'm gonna assess in between the fingers. There's no skin breakdown. I'm gonna assess for upper extremity strength by asking the patient to do the hand grip and squeeze both of my hands. Okay, the hand grips are equal. Mr. Smith, if you can press up against my hand. All right, try to resist. I'm gonna press back and assess for hand strength. Okay, his strength seems to be okay for his age. All right, and so now we're gonna move on to the lower extremities, okay? So the skin is clean and dry. There are no breaks in the skin. I'm gonna assess for flexion and extension. Okay, I'm gonna dorsiflex. Mr. Smith, I'm gonna press upon your foot. Can you please tell me if you feel any pain? We're pressing. There is no pain in the calf muscle. If there was pain upon dorsiflexion, then the patient could possibly have a blood clot or thrombophlebitis. Plantar flexion without a problem. There's no breaks on the heel of the foot. We're gonna assess the capillary refill on the toes. Less than 3 seconds. There's no breaks in between the toes. There's nothing on the heel of the feet. Mr. Smith, is there any other complaints that you might have? So Mr. Smith does not have any complaints. We're gonna cover him up and put him in a comfortable position. All right. And we're going to lower the bed, place the call light within reach, and I am going to wash my hands and document.